Welcome to Let's Clear the Air, a podcast sponsored by the Allergy, Asthma, and Sinus Center, dedicated to educating listeners about allergies, asthma, and immunology.
Welcome to this episode of Let's Clear the Air, all things allergy, asthma, and immunology. This is your host, Marcella Feathers, and I have the pleasure of being here today with Dr. Erin Rohman. Hello, Dr. Rohman.
Hi, thanks for having me today, Marcella. I'm excited to be here.
We're excited to have you. It's been a moment, so I am thrilled that you're back in our recording studio, as such it is.
Yes, thank you.
Oh, you're very welcome. So today we are going to touch on sinusitis versus allergies and what the difference is between each of those and symptoms and treatments, diagnosis. So let's just jump right in. Can you define what sinusitis is? Let's start there.
Right. So sinusitis can be acute or chronic. And I think it's important to know the difference between the two. Chronic sinusitis patients tend to have a recurrence of their symptoms repeatedly over time. And I would say those symptoms are typically longer than 6 weeks. Those symptoms are ongoing. They can flare up. They can come and go, ebb and flow, so to speak. Mm-hmm. And then we have acute sinusitis, and that is symptoms come on quickly, and with proper treatment, they can resolve quickly. Whereas with chronic sinusitis, those symptoms are more difficult to resolve. They take more time and can require different treatment regimens to resolve that. So sinusitis itself, a great description would probably be both infection and inflammation in the sinus cavities. Usually we can make a diagnosis based on symptoms and physical exam, but sometimes that takes some extra imaging, x-rays or sinus CAT scans to really define what is going on. So yeah, I think that's a good start for sinusitis, infection and inflammation of the sinuses, and then we sort of break that down into an acute or a chronic problem.
What are patients complaining of when they come in to see you that kind of sets those flags flying?
Right, sure. So a lot of patients come in with thick nasal discharge. So that can be green or yellow or white. The color doesn't necessarily determine infection. I try to remind patients of that.
Yeah, I always thought it did, yellow.
Right.
Infection.
But that's not always the case. But thick nasal discharge, some patients complain of a foul smell in their nose, a foul taste in their mouth or their throat. Some complain of bad breath. And then we get postnasal drip, sinus pressure, headaches, cough. So as you can see, the symptoms can be a pretty wide range of things, and they're variable. They're not always just the typical, I have a snotty nose, I must have a sinus infection. It can be a lot more than that. So differentiating often is difficult for the patient and often takes the expertise of a provider to help give a final clinical diagnosis.
Are there certain times of year when sinusitis or acute or chronic are more likely to be the culprit?
Oh, great question. So I think acute sinusitis can flare up at any time. It typically starts with a viral infection. So you might get a cold and then that cold doesn't get better. And those sinuses are inflamed, and then infection can take over, and it becomes full-on acute sinusitis. So that can really happen at any time. Of course, the viral respiratory season, which starts around October and goes all the way through March, sometimes lingers into April if you're unlucky. Those can sort of be peak times for the respiratory infection. So if that's what leads to your sinus infection, we might say winter season would be the worst time. For chronic sinusitis patients, a lot of times you can get flare-ups during your allergy season. Now, as we'll probably get into later or even maybe in another podcast, everyone's allergy season can be different. So if you have chronic sinusitis, allergy season could be any time of year for you and not necessarily just what we think of as spring and fall being those typical allergy seasons. So long story short, we went for a roundabout way there, but I think sinusitis can happen any time of year.
So one of the, I guess, kind of a clue as to the difference between allergies and sinusitis is that allergies can cause sinusitis.
Oh, that's a great point. Yes, allergies can lead to sinusitis. And again, that's where for the patient, it can be very difficult to differentiate those symptoms. How long have I had these symptoms? How severe are they becoming? And often it takes, again, the expertise of a provider to help a patient differentiate exactly what's going on for them.
Okay. Now, is there a fever associated with sinusitis? I guess if it's an infection, then yes, there would be a fever.
Occasionally, but not always. So, especially in chronic sinusitis patients where the sinuses are almost always inflamed and almost always have some level of infection, you may not see an acute fever necessarily. Acute sinusitis, oftentimes that viral respiratory infection that triggers it or starts the whole process, you might have a day or two of fever, maybe even just low grade chills, malaise, not feeling great. But by the time you have acute sinusitis, you may not even be having symptoms of fever anymore.
So what do you do when a patient comes in with these symptoms? How do you start the process of making them feel better?
Right. So the first thing we do, of course, is take a careful history. We hear about how long, again, those symptoms have been going on, what triggered it, how did they start, how have they progressed. And then, of course, the physical exam is very important. If it's very obvious from the exam, which again is going to be mainly in the nose and throat for sinusitis, maybe the ears as well, then we'll start them on a course of antibiotics if that's appropriate, maybe some nasal decongestants. Again, every patient's a little different. Your medical history determines a lot of how you get treated. Have you had a lot of antibiotics in the past, and how did you respond to those? So every patient is going to be different, and that's what's fun about my job is every patient is a different puzzle to figure out. But yeah, I think what we start with is that physical exam and then sort of take it from there. Does it lead us to wondering if they do have allergies triggering this and maybe get into some allergy testing? Does it lead us to maybe this is a chronic thing because when I look back in your chart, this is the 4th time you've been in this year with these same symptoms, and here we are again doing the same treatment of antibiotics. So maybe we start looking towards some imaging of your sinuses at that point. So, every patient's visit with their provider will look a little bit different. But again, starting with that physical exam.
And we definitely would want someone to come in who's been struggling with this regardless of however long it is, just that loss, as you said, loss of sense of smell, taste, or the odd taste in the back of your throat, or not being able to breathe well, or the headaches, or the pressure, the sinus pressure.
Sure. So I think you're right. It's some patients get used to feeling like this, and especially maybe if you've been dealing with this since childhood, and it's something that you've been in and out of the doctor's office frequently, and you don't realize that this is not normal. We don't have to feel this way. We could get some treatment here that would take us beyond this back and forth to the doctor 3 to 4 times a year. And I'm amazed at the people that do come in and that's been their story, and we're able to make such a big difference and an improvement in their quality of life.
Yeah, I know you are definitely one of the providers, when we have several, the majority of them, who will, when a patient is seen over and over for similar symptoms, be like, okay, something's still not right. Let's fix this. Let's find out really what's going on and work with patients rather than just, that turnstile approach that some people will.
That's right. And urgent care and primary care, they have a different a different job. Their approach is different. Their urgent care especially, they're there to get you feeling better quickly. They don't often have time to go into looking for the root cause, and that's what we focus on at Allergy, Asthma, and Sinus Center, is getting to the root of the problem, whether that is chronic sinusitis, whether that's some sort of allergic condition that we can treat. And we don't have time to get into the details of it now, but some patients even have disorders of their immune system that make them prone to chronic sinusitis specifically. So there are so many things that we can look into and help a patient get answers to these long-term problems that they've just sort of been living with all this time.
Excellent. I love that. That's one of the things I love best about working here, is that we have those experts, and each one of you is dedicated to finding that answer, as you said, getting to the root cause.
Yes, getting to the root cause and helping patients get on the right path to better health.
Awesome. All right. Well, thank you, Dr. Rohman. We appreciate your time.
Yes, of course. Thanks for having me again.
All right. Thanks for listening. And that does it for this episode of Let's Clear the Air.
We hope you've enjoyed this episode of Let's Clear the Air. Please consider following this podcast, and remember, if you want helpful and accurate information about allergies and asthma, our allergy experts are here to clear the air.